name is Dakota Bassett, and this is speech number 4, the persuasive speech. My purpose is to persuade my audience to vote for the health care reform proposal. Why is health care reform such a hot issue right now? Nearly 46 million Americans are uninsured, and another 25 million Americans are underinsured. So fewer Americans have health insurance and therefore are unable to afford quality medical care. Today, the suffering economy and health insurance go hand in hand. If the people of America want the economy restored, it is crucial that the healthcare system gets reformed as well. The U.S. is the only industrialized country that does not assure health coverage for all its citizens. Resulting from this are families who are not only faced with the normal day-to-day out-of-pocket expenses, but they're also trying to keep up with them. They try not to fall behind. There is a good chance 5 years from now the people of America won't have the same health insurance they have now, or they won't have the same health insurance they don't have. Unlike Hillary Clinton's attempt to change the medical system in 1993, this time doctors, insurance companies, pharmaceutical manufacturers seem to be in the midst of all of it. Although healthcare reform is controversial, its positive benefits to the people of America, such as improving the overall quality of healthcare and lowering the cost of healthcare, an expansion of the healthcare for women far outweigh the negative aspect of the future. There are several different provisions that are included in the bill. Just to name a few, the health insurance exchange providing individuals and small businesses with choices for coverages, including a government-funded public option, eliminate coverage exclusion for a pre-existing condition. So if someone tries to go get insurance and they already have a pre-existing condition, such as breast cancer, they will not be able to get the coverage as someone who did not have breast cancer when they go to get insurance. It'll limit out-of-pocket spending as well. The House proposal will begin the process of fixing what's broken about our healthcare system, reducing costs for all, building on what works, and covering an estimated 97% of all Americans. Obama said that in a written statement, and he also stated that by emphasizing the prevention and wellness, it will also help improve the quality of health care for every American. President Obama gave a speech on September 9th of 2009 describing the positives of healthcare reform. There are benefits for the fortunate people who have insurance and less fortunate who don't have advantages of insurance. For those who already have insurance, they don't lose anything from the current health insurance coverage plan they currently have, but they'll gain more stability and security. For the people who currently don't have insurance, there will be a quality, affordable choice for all Americans. On the flip side of reforming health care, there are 5 obvious freedoms that Republicans believe the people of America would lose. All 5 of the freedoms that would be lost contradict every word that the President has promised. First and foremost is the freedom to keep your existing plan. Republicans think if the health care is reformed, your plan you currently have will not be there. This is the freedom that the President keeps emphasizing, yet the bill says otherwise. It says that you will get to keep your plan. The legislation divides the insured into 2 main groups. These 2 main groups are treated differently with respect to their current plans. The freedom to choose your doctor will be lost. That would be the second freedom. The flexible employer-based plans now dominate the landscape that the Americans appreciate. Could fade away far faster than the 5-year grace period that's hardly being discussed currently. The third freedom that would be lost is the freedom to choose what's in your plan. Republicans believe the ability to choose what's in your plan is the cause of the raise in health care. Today, the freedom to choose your high deductible coverage is going to be gone. Hundreds of companies now offer health savings accounts to about 5 million employees. And last, the freedom to be rewarded for healthy living or pay your real costs. First, it forces young people who typically have lower incomes than older workers to pay for more than their actual cost, and gives older workers who can afford to pay more a big discount. That'll give them a bigger discount. And second, the bills would ban insurers from charging premiums based on the health of their customers. Essentially, women rely on their husband or a spouse to be the primary insurance carrier for the family. Women who hold a full-time position are employed by a small company who don't offer the quality health insurance coverage opposed to a male. Those who are unemployed, single, or employed at a company who doesn't offer health insurance generally depend on private or public programs. And then comes into play the pre-existing condition, and if you're a single mother, that's another factor to going along with if you qualify for insurance. Research shows how mothers take primary responsibility for meeting the children's healthcare needs. Therefore, women are more likely to be affected by insurance-related problems. The majority of private insurance policies exclude coverage for raising a child or children. The insurance companies also exclude the treatments and tests that women need the most. The treatments and tests are usually the preventative measures that need to be taken to detect a serious life-threatening disease. The insurance opportunities for single mothers today are limited. For a single mother and 2 children, but the mother also has an illness such as breast cancer, insurance companies who will cover treatments in her and her 2 children are rare. What are pregnant, if a woman was pregnant and she can't afford insurance? Some women in that situation take their chances just by skipping the doctor's visits and hoping for the best. An upsetting 15% of American women receive no prenatal care in their first trimester. That alone contributes to our appalling high infant mortality rate. Another option is to spend down to qualify for Medicaid. Even then, they can end up without prenatal care at all for long periods of time. For women to get a decent insurance coverage plan usually takes a full-time job employment. According to a 2007 Pew poll, 60% of mothers working full-time would prefer a part-time position, while some keep their full-time jobs for the high income. And many others say because they have no other way to get health insurance benefits, get a policy before conceiving is what they are told. So that's kind of useless information to them. They can't. It's kind of hard. But in conclusion, the healthcare needs to be reformed in order for our economy to be restored, for women with pre-existing conditions. I mean, the infant mortality rate is huge. Women need that for their prenatal care. Yeah.